me check my orders. It looks like I have an order for Abby Corlone, date of birth 07/22, to place a peripheral IV. So I'll just gather my supplies for that. Hi, my name is Avery. I'm going to be your nurse today. Can I verify your name and your date of birth?
Hi Avery, my name is Abby Corlone and my date of birth is 7/22.
Okay, awesome. So Abby, today we're going to be placing a peripheral IV. Have you ever had one of those done before?
No, I don't think so.
Okay, so basically we're going to get a little needle that has a catheter around it, and we're going to be placing that in your vein, removing the needle but leaving the catheter. That'll just give us access to give you IV fluids, medications, even antibiotics through your IV. That'll just kind of help you get feeling better sooner. Does that make sense?
Yeah.
Okay, awesome. Do you have any questions about that?
I don't think so.
Okay, are we good to do that today?
Yep.
Okay, awesome. I'm just gonna get some of my stuff ready, and then I'm gonna kind of check your veins, and then we'll be good to go. Okay.
All right.
All right. So I'm just gonna prime this line with some saline, making sure there's no air in there. Awesome. I'm just gonna loosen this. Okay. All right, and then Abby, I'm just gonna put this tourniquet around your arm just to kind of look at your veins and see where we want to go. Does that make sense?
Yep.
Now this tourniquet is going to be a little tight around your arm because it's going to help me see your veins a little better, but it shouldn't be painful. It just might be a little uncomfortable, okay?
Okay.
Okay, awesome. All right, I'm just wanting to make sure I pick a spot where there's no skin rash, scars, or any other like skin conditions. I think we have a pretty good vein right there, so I'm just going to release that for now and go get the rest of my stuff ready, okay?
Okay.
Grab a pen so that I can write on this, writing my initials, the date, and have a 22 gauge needle here. All right, Abby, I think that we're ready to get started. So I'm just gonna put on some gloves, and then I'm gonna be cleaning your skin for about 30 seconds just to make sure everything's super clean. We don't want any chance of infection or anything. So I'm gonna clean 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, now that that's all clean, I'm going to try to steer clear of that area when I put the tourniquet on, keeping that really sterile and clean. I'm going to just move some of these things over to make it a little easier. Okay, Abby, and I'm going to get ready to put this IV in. Again, there's going to be a small little poke initially, and then you shouldn't feel any pain, okay?
Okay.
All right. Okay, so I'm just going to anchor your vein. 1, 2, 3, poke. Awesome. Now that I've gotten a flash, I'm going to just lower it and insert the IV. Good job. Okay, I'm just gonna pull back and take off the tourniquet, just kind of stabilizing that. And then I'm going to attach the saline extension tubing. I'm just gonna push this saline fluid. It feel any pain when I do that?
Nope.
Okay, awesome. I also don't see any swelling or bumps, so that looks good. So I'm just gonna lock that for now. And then I'm also gonna place this around your IV site just to really keep it still. Awesome. And I'm going to put a piece underneath the IV hub just so that it's a little bit more comfortable and doesn't rub against your skin.
Okay.
As well as this to verify the date that it was placed. I'm going to place it up here so that I can still see the IV spot, and detach this and securing it right up here. Awesome. Okay, Abby, so everything looks great. We want to make sure and be clear of any signs or symptoms of infection. Those would include any fever, chills, redness of the area. If you notice any of those things, be sure to let me know immediately, okay?
Okay.
And then as well, we just want to make sure that the area stays clean and dry. So if you notice any leaking of the IV, maybe any blood leaking out or anything like that, let us know as well if it gets loose. We just want to make sure that that stays secure and clean, okay?
Okay.
All right, I'm just going to clean up some of my things here. Make sure to put this in the sharps, and then I'll go document that, and I'll come back in just a little bit. Let me grab this tourniquet from underneath you, and I'll be right back. And I'm just going to make sure I leave you in a low locked position. Your collar light's right there.